guilty of it, right? We're in a hurry, we're hungry, and so we just go to the drive-thru, the nearest fast food restaurant. But just because it's convenient doesn't mean it's good for you.
Indeed. Christina, don't worry, because today we are here with nutritionist Dr. Felicia Stoler, and she is going to teach us some simple ways to keep our hearts healthy. God, good to have you with us.
Nice to be back.
So, you know, one of the things when we think about heart health, people frequently think of that as a man's issue.
Right.
But it's not. It's very much a woman's issue as well.
Well, everybody, right? So heart disease is still the #1 killer in this country.
Wow.
Among men and women. I know that we all fear cancer, but heart disease really is the #1 killer. And the truth is there's so much that we can do to prevent heart disease and to prevent having some kind of cardiac incident. Not to take away the fact that some people have it sort of in their genes.
Yeah,
I mean, that's something
history.
that in my family history, there's a lot of heart disease. So all the things we're going to talk about today are all the things that I do because I want to avoid that. I want to prevent it. I've had the benefit of being in a field so I could learn a lot about it. So I can really try to work hard to undo anything that maybe is in my genetic makeup.
Why is it more prevalent, though, for females than males?
Well, I think the issue really is that a lot of times women are not taking care of themselves. We put everybody else first, especially the moms, right? And, you know, and dads do the same thing, too. But, you know, I think for a lot of women, myself, I'm just as guilty. This year, I decided this is the year I'm going to make sure I get all those extra doctor's appointments that I've sort of put off.
Right.
So it's about making the time to take care of ourselves.
Go down the checklist.
And I think we're a little bit more stressed out than men are because we feel like, especially working moms, feel like there's a lot more on our plate, so there's a lot more stress.
Right.
Well, let's...
And then, again, more fiber. And, you know, you hear a lot about brown rice versus white rice. So what I like to tell people is it's not about the color of the food, it's about the fiber. So when you're comparing white rice to brown rice, there's about 1/2 gram of fiber in the brown rice to 0 grams of fiber in the white rice. So it's not a significant source of fiber. So instead, what is something you can try? You can try quinoa, right? There's other rice blends that are out there. And if you don't like some of these things, and for some people that are gluten intolerant, they have issues with fiber, there's a great fiber product out here. So the Sunfiber I love, they're coming out with a new line soon that's going to be single serve packets, which is great for grab and go. It has no flavor at all. You can put it in your coffee, put it in your water. It is completely gluten-free. It's the only gluten-free fiber supplement because that's a problem for people with celiac disease is getting fiber.
Right. You know, I hear about supplements and sometimes I worry that taking a thing, like it's always better to get the nutrient in the food.
You're right.
But can we make use of that kind of fiber?
You can bake with it. Yeah, what I could have brought today too is some pasta that has added fiber. So inulin is a fiber that's often added to foods. You might see it in granola bars that say added fiber. When you see yogurt that has fiber in it, because milk does not inherently have fiber in it, there's usually inulin that's added to it, right? And then, so again, so fiber is really good because it does help to lower your cholesterol, pulls the cholesterol out of your body, and keeps everything running smoothly.
We hear a lot about